In this video lecture, we're going to be discussing the biological approach to anxiety disorders with a particular focus on thinking about some abnormalities in brain functioning that might characterize our anxiety disorders. This is Alex Honold. He is one of the world's most accomplished rock climbers, and he's particularly well known for his free soloing. So free soloing is rock climbing where an individual is not tied in, so they are not linked to a partner, and they are not linked to the mountain, so it is a much more dangerous kind of rock climbing than even typical high-level rock climbing. This is Alex Honold free soloing El Capitan in Yosemite, a 3,000-foot incredibly technically difficult climb. This is an image from his successful free solo of El Capitan in 2017. He was the first person to successfully free solo El Capitan. And this is an image from the documentary Free Solo. The very first thing that I thought when I saw Free Solo was, I desperately want to see Alex Honold's amygdala. Luckily, I am not the only person to have had this thought, and one of the individuals who also shared this desire had access both to Alex Honold and to an fMRI. So in this image, we can see a comparison between Alex Honold's brain on the left and another rock climber who was selected because he was similar in terms of gender and age, and also an individual high on sensation seeking, to look at differences in their patterns of brain activation. So both of them were assessed in an fMRI, and they were shown a series of 200 emotionally arousing images. So this is a series of visual images that typically elicit a high level of distress, anxiety, and fear. And on the right-hand side, we can see that this individual had much higher activation, and the area in the crosshairs is the amygdala. So as we would expect in a normal population, when shown this series of distressing and arousal-inducing images, we're seeing high activation in the amygdala, which is the structure in the limbic system that's very involved in our emotional responses, particularly our emotional responses to fear. On the left-hand side, you can see that Alex Honold's brain looks very different. So it's not that there's no activation in his brain. We do see brain activity. He's awake, he hasn't fallen asleep. We can see activation in his occipital lobe, so we can see that he's looking at these images and he's processing visual stimuli. But in the crosshairs, where we would expect to see amygdala activation, we see no activation. Before they looked at the fMRI, they did check some structural imaging to make sure that Alex Honold had an amygdala, and he does have a structurally normal amygdala, but as we can see here, the functioning of his amygdala is very different from typical individuals, even highly sensation-seeking typical individuals. So Alex Honold provides us an example of an individual who clearly experiences abnormally low levels of fear and anxiety, and this corresponds to very low levels of amygdala activation. We can see further evidence for the involvement of the amygdala in anxiety disorders from looking at studies of amygdala activation in clinical populations. So I'm going to show you findings from a study of 17 pediatric patients diagnosed with generalized anxiety disorder. In this study, they were compared to a control sample of 12 individuals with no psychiatric diagnosis. They were selected to be comparable in terms of gender and age. And this was another fMRI study. And in this study, they were using fMRI to assess vigilance to threat. And they were particularly interested in assessing vigilance to threat when this threatening information was presented so quickly that individuals would not be able to process it consciously. So the paradigm that they used for this study, the individuals were in the fMRI, and at the beginning of each trial, first they would be shown a fixation point, so they're told to look at the plus at the top of the screen. And then for a very, very brief amount of time, they are shown two images, one on the left side of the screen and one on the right side of the screen. And on the trials that we are most interested in, one of the images that was presented was an angry face, and one of the images that was presented was a neutral face. So the angry face is representing a potential threat. These images were presented very, very briefly for 17 milliseconds. So this is so quickly that we know that the individuals are not going to be able to consciously process this visual information. And after this very brief presentation of these faces, these images were masked. So they were shown a jumbled up version of the picture so that you can't make out what it's a picture of, but for another 68 milliseconds, they are shown these masks. After this masking image is shown, a target appears on the screen, and the individual's task is to click a button that corresponds to whether the target shows up on the left-hand side of the screen or the right-hand side of the screen. So in the findings that I'm going to show you in a moment, we are going to be looking at the differences in amygdala activation between two different kinds of trials. On the incongruent trials, the individual was asked to respond to a target stimulus that was on the same side of the screen as the neutral face. So they are being asked to attend to the same region of the image where there was a non-threatening stimulus. On the congruent trials, the individual was asked to respond to a target that was presented on the same side as the angry face, so this potentially threatening stimulus. So what we are looking for is whether there is a difference in amygdala activation when individuals are asked to attend to a neutral stimulus compared to when they are asked to attend to a potentially threatening stimulus, even when those stimuli are presented so quickly that we know that the individual is not going to be able to consciously process that information about potential threat or danger. So in this image, we can see the difference between our 17 participants with generalized anxiety disorder compared to our healthy control sample. So our y-axis in this image is showing the change in right amygdala activity from baseline. So a positive change is representing an increase in amygdala activity. The masked angry bars are showing our congruent trials. This is when the individual is responding to the target stimulus that's on the same side as the angry or threatening face that was shown very briefly, compared to the lighter gray bars, which are showing the reactivity to that masked neutral face. So when the participant is responding to the stimulus that's on the same side as that neutral emotional image. So among our participants with generalized anxiety disorder, we see a very clear pattern of increased amygdala activity. And this was particularly pronounced in the right amygdala when looking at the image with the masked angry faces compared to the masked neutral faces. When we look at our healthy control sample, we didn't see significant differences between the two different kinds of trials. And if anything, we see a little bit of the opposite pattern, that we're not seeing much of a change in amygdala activity with the masked angry faces, and we're seeing a slight increase in amygdala activity on the trials where they're responding to the area of the screen with the neutral face. So this is providing pretty clear evidence that our participants in the study with generalized anxiety disorder are experiencing this hypervigilance to threat, and that this is characterized by increased amygdala reactivity, specifically to these potentially threatening cues in the environment, even though these potential cues are presented so briefly that they can't be consciously processed. Another piece of evidence consistent with this is that when we look within those 17 individuals with generalized anxiety disorder, we see a significant association between the severity of their anxiety and the degree of emotional reactivity that we see in the amygdala in response to those masked angry images. So in this image, we're seeing only results from the participants with generalized anxiety disorder. The color coding is breaking them up into two groups because some of the participants in this study also had a comorbid diagnosis of major depressive disorder. So in this image, we can see that both for patients with major depressive disorder and without major depressive disorder, that as the severity of their anxiety symptoms increased, the degree of amygdala activation in response to the masked angry faces is increasing. So overall, results of this study are consistent with what we might expect based on Alex Honold's amygdala, which is that individuals who experience high levels of anxiety have increased amygdala reactivity. Their amygdalas are more reactive to the presence of potentially dangerous or threatening cues in their environment.